After hours of labor, a woman becomes a mother when she gives birth to her baby. The artist's 9-month wait is now over, and the nurse carefully places the newborn on the mother's chest for a skin to skin contact. This process is considered crucial as the mother's bond with the baby begins. Moreover, breastfeeding is a natural process of nursing the baby, which is also known as the golden hour for the first 1 hour after the baby is born. To know more on breastfeeding, more so ever being International Breastfeeding Week, we have with us Dr. Latha Kanchi Parthasarathy, consultant neonatologist at Apollo Women's Hospital, Shafi Mahmud Road, Chennai. Good evening, doctor.
Good evening. Hello, everyone.
Is breastfeeding a learned skill?
I would say yes and no. For some people, it is a learned skill. For some people, they do need help. But when it doesn't happen naturally, you don't need to feel guilty. You don't need to feel guilty, as well as you don't need to worry about it. Yes, there are lots of people to help you to get breastfeeding established. So, I mean, if you can actually do it, that's well and good. If you don't do it also, there are people who can help you. Are nurses, doctors, there are lactation consultants these days. So you can get plenty of advice from anyone.
How does breastfeeding contribute to a mother's health?
Okay, we all know breastfeeding has benefits both to baby as well as to mother. I mean, anyone can Google it and read what are the advantages. But when it comes from a doctor, usually we tell that when for the mother, she has her uterus involuting to its normal pre-pregnancy. That contraction happens once she's breastfeeding. Second thing, she can lose her pre-pregnancy weight. And third thing, there is a lot of advantage in reducing the risk of getting breast cancers. We all know these days, wherever you see someone with a breast cancer. So it will help to reduce the risk of breast cancer as well as ovarian cancer.
How does one get to know if the baby is getting enough breast milk?
Okay, so this one is, each one's understanding is very different, and there is conflicts always when you talk to different people. The message gets very differently across from everyone. So to any mother, I would say you breastfeed your baby, and between the feeds, if the baby is happy, sleeping, contented, that is the most important thing. So babies do cry for everything. Like that's the only language they can talk or let us know. So they do cry for like if the room is very hot, or they are feeling very cold, or they've passed urine, passed motion, they always do cry. So don't take it as every time the baby is crying for a feed. And if the baby is contented between your feet, that is the best clue. And they also pass plenty of, like we always ask about wet nappies. If they have adequate wet nappies, we know that the baby had enough feeds. I think that's about it. As I said, happy baby is a clear indicator that the baby had enough feed. And also you always check the weight. We do bring babies back, especially in the first, maybe I would say about 6 to 8 weeks. I bring my babies regularly. One, because we want to make sure baby is getting the feed so that we can check the weight. Weight is the best indicator. If the baby has had enough feeds, the weight would definitely go up. Then we don't need to worry about, even if it's a fussy baby, crying baby all the time, we don't need to worry about breastfeeding, that milk availability as such.
How can I avoid colic while breastfeeding?
Okay, so babies do get colic for several reasons. If maternal diet, sometimes maternal diet can also play a role. We know that the extended family, grandmother, they all look into the diet of the mother. They make sure they don't give a diet which will affect a baby's tummy. In spite of that, babies can get a bit colicky, and we can avoid, maybe each baby is different. Some babies can be sensitive to some food. So whatever you think your baby is getting colicky after whatever you have eaten, I would advise you keep a diary, write it down, and then see what you've eaten that must have affected the baby's tummy. So try and reduce the volume, or try and avoid taking that food. And also after feeding, you make sure you do the right positioning, right latch, so that baby doesn't swallow too much of air, and also burp the baby as soon as the baby is fed. In spite of all this, sometimes some diet in the mother, mother taking milk, or baby is not able to tolerate the milk in from mother's intake of cow's milk. Some babies can get very fussy and irritable, so we have to just identify. But if the baby is crying more than usual, it's always better to get it checked by a pediatrician.
You spoke of burping. Is burping a baby post breastfeeding compulsory? How does it help the baby?
Okay, as I said, babies do swallow a lot of air. So when feeding, they can take a lot of air in, and that can make them colicky also. So that is the reason why we tell you to burp the baby once you finish your feeding. Not all babies are easy to burp. Some babies can burp spontaneously within minutes. Some babies take even half an hour. So we always see parents telling doctor, "Romba நேரம் வச்சிருந்த 1 hour வச்சா கூட வந்து எங்களால burp பண்ண முடியல." Sometimes it doesn't happen. So we don't need to worry. Other reason why we tell you to burp, when they are burping, they bring out some amount of milk with it. So if they are not burped halfway through their sleep, then they vomit, and that is another stressful situation for parents. So adnala we tell burp, try and burp it as much as possible. Neriya thara position solli kodupom, eppadi burp panna, by rubbing the back, or when you lift and put them on shoulder. These kind of things will help the baby to burp easily. அது மீறியும் நிறைய babies will not burp, but அதனால வந்து ஒன்றும் worry பண்ண வேண்டாம்.
Speaking of mothers, food do's and don'ts, are there any particular foods that one must avoid while breastfeeding a baby? Or should one eat more or less, or drink more fluids? Or basically, what is the diet that a mother who is breastfeeding should follow?
அதே மாதிரி தான் there are lots of myths about breastfeeding, mother taking dieting. அந்த மாதிரி எதுவுமே whatever works for you and your baby, you should be able to eat. நிறைய இது ரெஸ்ட்ரிக்ட் பண்ணுவோம், பட் if it's obvious things like ரொம்ப தூர்தால் சாப்பிட்டா ஒரு சில babies will become too colicky, and then or நிறைய motions பாஸ் பண்ணுவாங்க, இல்லை lot of spicy food, காரம் ரொம்ப மசாலா இருக்கிற ரொம்ப இது வந்து ஜென்ரலி வீட்டல், அண்ட் அதை உருளைக்கிழங்கு அந்த மாதிரி வந்து எவ்ரிதிங் இன் மாடரேஷன் இஸ் ஓகே. அன்லெஸ் யூ ட்ரை, யூ வில் நாட் நோ வாட் யோர் பேபி டசன்ட் லைக். அதனால நான் என்ன சொல்லுவேன்னா, யூஸ்வலாக வந்து எல்லாமே கம்ப்ளீட்டாக அவாய்ட் பண்ணிட்டு மதருக்கு என்ன சாப்பிட்றதுன்னே லிஸ்டே இருக்காது. அதனால இஃப் யூர் நிறைய என்ன சொல்லுவோன்னா, ப்ரெக்னெண்ட்டாக இருக்கும்போது வாட் எவர் யூ ஆர் யூஸ் டு, யுவர் பேபி வுட் ஹவ் டேஸ்டட் தோஸ் திங்ஸ் அப்பயே. அவங்களுக்கு வந்து மெஜாரிட்டி அப்போ அவங்க சாப்பிட்டதெல்லாம் ஒத்துக்கும். அதை மீறியும் வந்து நமக்கு ஒரு சில டைம் ஒத்துக்கலை அப்படின்னா, அது ட்ரையல் அண்ட் எரர் வச்சு எக்ஸ்க்ளூட் பண்ணுறது தான் என்னுடைய அட்வைஸ். டோன்ட் கம்ப்ளீட்லி கட் டவுன் ஆல் த நியூட்ரிஷியஸ் ஃபுட், இல்லைன்னா மதருக்கு ஒரு ஆப்ஷனே இல்லாமல் ரொம்ப ரெஸ்ட்ரிக்டடாக வைக்க வேண்டாம். லெட் ஹர் ட்ரை. அது மாதிரி ஃபுட் டைரி வச்சுட்டு எது பாப்பாக்கு ஒத்துக்கலையோ அதை அவாய்ட் பண்ணிக்கலாம்.
Apart from food, what are the other common breastfeeding myths that women today have, or even people, or even the family around has?
Okay, நிறைய what we come across is small breast இருந்தா milk production பத்தாது, milk சரியா வராது அப்படின்னு சொல்லுவாங்க. The size of the breast doesn't really matter. நமக்கு வந்து by nature you are meant to be producing enough milk for your baby, but நிறைய தடவை வந்து மதரோடைய மெடிக்கல் கண்டிஷனோ இல்லை ஸ்ட்ரெஸ் ஃபேக்டர் ஆர் அவங்களுடைய டயட், இது எல்லாமே வந்து நிறைய கான்ட்ரிபியூட் பண்ணும் அவங்களுடைய மில்க் ப்ரொடக்ஷனில். அதனால வந்து யூ டோன்ட் நீட் டு அப்படியே அதை ஃபிக்ஸடாக இருக்க வேண்டாம். அதே மாதிரி ஜென்ரலாக we tell take plenty of fluids, நல்ல adequate balanced diet எடுத்துக்கோங்க. adequate balanced diet, plenty of fluids, and take adequate rest. Stress factors வந்து கொஞ்சம் கம்மி பண்ணுங்க. இது எல்லாமே பண்ணா breast milk production would be sufficient, or it will be better than what it was before. வேற என்ன மித்ஸ் யூஸ்வலா எங்களுக்கு அடிக்கடி கேட்கறது என்னன்னா, ஸ்மால் பிரெஸ்ட் டிஸ்கஸ் பண்ணோம், தென் இது அதுக்கப்புறம் வந்து is there anything particularly you want to ask me?
We have one question from a new mom. She says she has rather small breasts, and I always have this feeling that I do not produce enough breast milk for my child. Is it true?
As I told just now, we discussed about small breast. I don't think the size of the breast matters. It is how strong she feels that she should breastfeed the baby. As I told you, nature itself will help the mother to produce enough milk. அதனால அதுலயே we should not really worry about it. And the more you feed, the more breast milk will be produced. Each time papa வந்து suck பண்ணும்போது there is a lot of hormonal release from mother, so which will help in the breast milk production also. So பாப்பாவை நல்லா suck பண்ண விட்டுட்டு, and also mother should நல்லா சாப்பிட்டுட்டு adequate rest எடுத்துட்டு, if she looks after herself also, breast milk will get better.
Demand feeding or scheduled feeding? What would you suggest?
I always suggest demand feeding. Demand feeding என்னன்னா, then we don't need to worry பாப்பா குடிச்சதா அடிக்வட்டா இருக்கா அந்த மாதிரி நம்ம we don't need to break our heads. Baby is asking, you feed. Whenever baby is asking, they are able to digest it better. நமக்கே வந்து someone else coming and feeding நம்மளுடைய இது இல்லாம அப்பப்போ வந்து ஃபீட் பண்ணிட்டு போனா how do you feel? Same thing for babies also. If they are hungry, they produce digestive enzymes and then they digest it better. இதுல இருந்து unnecessary vomiting இதெல்லாமே வந்து avoid பண்ணிக்கலாம். So go for demand feeding always.
What can I do about sore nipples?
Sore nipples is something we are seeing more frequently. முன்னாடியெல்லாம் அவ்வளோ எனக்கு தெரிஞ்சு அவ்வளோ பார்த்ததே இல்லை. இப்போ வந்து sore nipples or like 10 mothers பார்த்தா அதில் 8 mothers are having sore nipples. I don't know exactly what is causing this. Maybe நம்ம ரொம்ப stressed ஆகிட்டு அந்த ஃபர்ஸ்ட் 2-3 நாள் milk வராம you put the baby again and again, maybe in an odd position, latching is not proper என்னும்போது, so milk வரலன்னு சொல்லி baby also sucks sometimes again and again. இதெல்லாம் factors இருக்கும்போது they can exaggerate the sore nipple. What we usually advise is, if you're try and preventing sore nipple is very important. ஏன்னா sore nipple வந்து very very painful. It just cracks. அதுக்கு அடுத்து subsequent feeds கொடுக்கறது ஒரு ப்ராப்ளமா இருக்கு. அதை மீறி sometimes blood வரும், blood baby will swallow and then baby will have blood in the stools also. That worries many parents. So அதனால sore nipple வராம prevent பண்றது தான் would be a better idea. அது வராம இருக்கிறதுக்கு என்னன்னா, how we make the baby latch. When they latch just at the nipple, நிறைய தடவை வந்து because it's a very delicate tissue, நம்ம கொஞ்சம் அப்படி புல் பண்ணாலே வந்து there is a lot of cracking. ஸோ அதனால அது பொசிஷன் வந்து ஏரியோலா அண்ட் நிப்பிள் ரெண்டும் சேர்த்து பாப்பா வந்து வாயில வச்சுட்டு நம்ம ஃபீட் பண்ணோம்னா that crack வந்து சோர் ஆறது வந்து கொஞ்சம் ப்ரிவென்ட் பண்ணிக்கலாம். If it really gets so, there are lots of creams available, like a moisturizing cream இல்லைன்னா unsalted butter. நம்ம ஃபீட் பண்ணாத டைம்ல you can apply those things, let the soreness get better and then you can feed on the other side. Until then feed பண்றதுக்கு முன்னாடி then you can clean it and go back. Like that you keep applying moisturizer regularly.
Are nipple shields good to use?
It's not a bad thing to use. Some others have really a flat nipple, so பாப்பாக்கு ஒரு latch பண்ண கஷ்டமா இருக்கும்போது we do advise this nipple shield. It almost அதனுடைய consistency it's like மதரோடைய nipple மாதிரி தான் இருக்கும். Some babies don't really mind it, they just latch very well. So it is very helpful, I would say, in mothers who are having flat nipple. So there is nothing wrong in it.
Is there any specific care that a new mom or a mom who's breastfeeding should take for her breast? Apart from the hygiene is a very important thing. I'm sure everyone is taking care of that, but always keep yourself. In summer and all, you will be sweating too much, so make sure you have shower a couple of times, and then you use your bra, everything like just how you would normally look after yourself, same thing, but just hygiene would be my advice. Is it common to have uneven milk supply, doctor?
Yes. See, when mother's diet, mother's hydration status and mother's stress levels, they all play a major role in the production of the milk. If mother is fed, watered and had enough rest, then the milk production is better, and the quality of milk also we tell mother நல்லா சாப்பிட்டுட்டு தூங்கி ஸ்ட்ரெஸ் இல்லாம இருந்து நல்ல ப்ரோட்டீன் டயட் எல்லாம் எடுத்தாங்கன்னா அந்த மில்க் டெஸ்ட் பண்ணி பார்த்தோம்னா அதுல உள்ள சத்து வந்து ரொம்ப அதிகம். ஸோ அதனால வந்து ஒரு டைம் வந்து எல்லாம் நல்லா ஸ்மூத்தா போயிட்டு இருக்கும்போது நல்ல மில்க் ப்ரொடக்ஷன் இருக்கும். சம்டைம்ஸ் வந்து அவங்களுக்கு ரெஸ்ட் எல்லாம் இல்லாம இருக்கும்போது மில்க் ப்ரொடக்ஷன் கொஞ்சம் கம்மியாகும். the quality of milk also varies. That happens very commonly. It's very normal for our human body to do that.
Is it normal or common to not get periods during the period of breastfeeding?
Yes. Sometimes it helps with like a natural contraception solvanga illaya. So for some, I mean, many mothers don't get periods for a while, so that is very normal.
And is it a cause of concern if somebody gets their periods
No.
during breastfeeding period?
No, it's not a concern.
What are the common treatments today for blocked ducts and mastitis?
Mastitis சரி, இந்த blocked ducts is very common. சடனா இப்போ மதருடைய மில்க் ப்ரொடக்ஷன் கெட்ஸ் ஐ மீன் இட் ரொம்ப நல்லா வந்துடுது அப்படின்னா some babies are not needing that much, so or not feeding very well. ஸோ அந்த மாதிரி நேரத்தில் the emptying is not complete போது நிறைய mothers do get engorgement. அந்த engorgement வரும்போது நம்ம வந்து we should either massage it, express the milk, அந்த மாதிரி பண்ணிட்டோம்னா then it doesn't get blocked. ஏன்னா too much production இருந்து baby suck பண்ணல, it's not letting it out, it gets engorged and it causes lot of pain. Not only pain, it just gets அப்படியே block ஆகி அதுக்கப்புறம் infection. That's what results in mastitis. It's all very painful situation. Not only painful, very stressful situation. mastitis வந்ததுன்னா மதருக்கு அப்புறம் ஆன்டிபயோட்டிக் போடணும். sometimes அது என்ன பக்ன்றதை பொறுத்து ஆன்டிபயோட்டிக் needs to be given for a really long time. இல்லை அதில் வந்து பஸ் வச்சிடுச்சுன்னா அது வந்து ட்ரெயின் பண்ணி பஸ் எடுக்கணும். ஸோ அதனால இது வரத்துக்கு முன்னாடியே தடுக்கிறதுக்கு என்னென்ன பண்ணணுமோ தட்ஸ் வாட் லைக் இஃப் யூஆர் பிரஸ்ட் ஃபீடிங் யூ ஃபீட் ஃப்ரீக்வெண்ட்லி. பாப்பாவுடைய டிமாண்டுக்கு ஏற்ற மாதிரி இஃப் யூ கீப் ஃபீடிங் தென் யூ டோன்ட் கெட். பட் நமக்கு அது மாதிரி என்காஷ் வந்தாலும் இம்மீடியட்டாக ஒரு ஹாட் ஃபர்மெண்டேஷன் நல்ல ஒரு வெதுன்னு தண்ணி வச்சு அதை மசாஜ் பண்ணிட்டு தென் யூ கேன் எக்ஸ்பிரஸ் இட் அவுட். தட் வில் ஹெல்ப் யூ இன் கெட்டிங் பிளாக் டக்ஸ்.
I am a mom of a 7-month-old baby and I'm planning to get back to work next month. What should I keep in mind? And I'm already feeling emotionally low. Kindly advise.
Okay, see, first positive things are positive. You have breastfed your baby for 7 months, which many mothers don't get these days, working mothers. So at least 6 months you exclusively you fed the baby. You have to look it as a positive thing. You're going back to work and then you will be still able to express your breast milk and leave it. If you have an extended family who's going to look after your baby, you can express the milk. And by now 7 months bodu you would have started weaning diet. In the நேரத்துல only breast milk doesn't meet the needs of baby's nutrients, so solids கட்டாயம் கொடுக்க வேண்டி இருக்கும். So you would be giving solid, but you can express and keep it. அது வந்து உங்களுடைய மதர் வந்து யார் whoever is looking after the baby can use that milk நடுவுல ஃபீட் பண்ணிக்கலாம், ஆர் நம்ம பண்ற சாலிட்ஸோட அதை மிக்ஸ் பண்ணிக்கலாம். ஸோ யூ ஹாவ் டு ஜஸ்ட் நம்ம டிப்ரெஸ் ஆகிறதுனால it's not going to favor in any way. உங்களுடைய மில்க் ப்ரொடக்ஷன் கம்மி ஆயிடும். ஸோ அதனால take it positive that you fed the baby for 6 months completely and you can still express and leave it and go, and then baby can enjoy with solid food. உங்க மில்க் மிக்ஸ் பண்ணதை யூஸ் பண்ணிக்கலாம்.
How can I store breast milk?
Okay, storing breast milk, it's gone really easier these days. நம்ம வந்து வெளியில வச்சோம்னா மில்க் எடுத்து வெளியில வச்சா usually I tell even if it's a air conditioned room, do it about ஒரு 2 to 3 hours maximum வைக்க சொல்வேன். Otherwise I don't encourage keeping it outside. If it can be stored in the fridge, you can keep it for 24 hours, or if you can keep it in a freezer, you can use it for a longer time. Usually fresh milk is the best, so we usually don't encourage to keep it in the freezer unless mother is traveling or she's having too much of milk. Then we can store it in the freezer. You can use it even after 10 days, nothing happens. But if it is in the fridge 24 hours, when you leave it in the fridge 24 hours, you take the whichever container has got it, and then you can put it in a bowl of hot water and immediately it comes to the normal temperature. Then you can test it by putting a drop on your hand, and then you can start feeding the baby. If it is in the freezer, then you have to thaw the milk. You can leave it in the fridge overnight itself. After 10-12 hours it will start loosening up. Then you can again, like as I said, or if you're taking directly, then you have to defrost it. And then, but I don't know, the quality of milk or the nutrients might be lost when we do that. So I don't encourage freezer on a routine basis or regular basis. Just fridge is okay.
Can I donate breast milk Is there a breast milk donation bank for this in Chennai?
Yeah, you would be really blessed by many people if you're able to donate your milk, because we're all looking like, especially intensive care units where they have really small babies, where they cannot be fed with formula. We are all dependent on breast milk for those babies, but their mothers, for some reason, or because of medical problems, they're not able to feed their babies. Then I would strongly recommend you to donate. I think we always get from IOG, ICH, Institute of Child Health. Vijay Hospital has a breast milk. Now lots of hospitals, even Apollo is looking for a breast milk bank where we can we can start the process of storing milk and donate and give it to babies whoever need it. If you want more information, then I can just find out exactly what needs to be done. If you call the bank, they'll be happy to explain exactly how it works. As I said, I can also find out for you and let you know. And as I said, if you can donate your milk, that would be the absolute brilliant thing.
Is it true that fenugreek is a herb that helps to increase breast milk?
Yes, yes. I think there are lots of research about fenugreek, not just fenugreek, lots of other things, garlic, then cumin, lots of things are there, oatmeal. Um, I can't suddenly remember all the stuff, but a lot of things are there. They're called galactogogues, and then you can, which will increase, and fenugreek is one of them. So definitely it does increase milk production.
I'm 8 months pregnant, and though I'm looking forward to breastfeeding my child, I'm scared if my breast will enlarge once I start breastfeeding. Kindly advise.
Okay. Um, so you are worried that the size of the breast will change. I will not agree with that your breast, yes, during the period of breastfeeding, to accommodate your baby's feeding, yes, the breast will fill up and then get bigger. It will look like that, but once we are all like after 6 months, 8 months, once you've lost all your pre-pregnant weight, then automatically the size goes back to normal. So I wouldn't worry about that. I would just think that we are lucky to feed our own baby.
Must the baby suck from both the breasts in each feed?
See here, this is again a mixed opinion. What I normally advise is, like, if your baby is not getting enough feed from one milk, yes, of course, go for the second one. But what happens most of the times is they just feed the fore milk, which comes in the beginning, and then the hind milk is the one which is rich in fat. If they don't get that fat part of the milk, they get very hungry and weight gain will also be slower. So I would advise always finish the one side first completely and then go for the other side if your baby needs it.
Is there a standard time, doctor, that you?
No, it depends on each baby. Some babies do really, they just finish the job and they're happy 5-10 minutes. Some babies just like that sucking, and they can take up to 40-45 minutes also. So it varies with each baby. So you have to just get to know your baby, read, in the first few weeks, then you will get to know.
Is drinking alcohol allowed during the breastfeeding period?
Drinking alcohol, okay, again, in the West, people are used to alcohol, so they have their own limits. During pregnancy, definitely I would say no, because alcohol can have effect on the unborn baby, whereas once after you've delivered, a small amount, I think you can have it. It all depends how much you are used to, once in a while, but generally try and avoid, because once you take too much of alcohol, if you take too much of alcohol, there will be some amount getting into the breast milk, first thing, and the second thing, then we become either very drowsy or sleepy, not able to care for your baby. So I would say, occasionally you can take small amounts, just small amounts.
Why do some women produce more milk than others?
I think it is how the body is prepared to. As I said, there are a lot of factors which encourages, or which helps a mother to produce milk, and their diet, how the baby is sucking, the demand. Sometimes the baby's demands are more, so the production also gets a balance. But it's some genetic factor also. So I won't be able to tell. So, sometimes lower socioeconomic group mothers are the ones who are able to breastfeed very successfully. So we know that it's not the diet as such. So there are other factors like genetic, and it is how the mother is determined also.
I am a mom of a 6-month-old girl and I have cracked nipples and also bleed sometimes. Is it okay to breastfeed my child?
Of course, you can breastfeed as far as you are comfortable. If it is too painful, as I said already, you can use some nip care cream, give rest to the breast for some time, or you can apply unsalted butter and then you feed on the other side. Once you're due to feed this side, then you clean it up and feed the baby again.
My nipples are as hard as a rock for the last 2 days and it's extremely painful. I tried heat fermentation as you had mentioned, but it's still the same. Is there anything else I can do?
I'm not really sure when you mean hard. If it is very painful, and then I would suggest you just get it checked by your obstetrician. Yes, sometimes they do get hard, and if there is no bleeding, you're able to feed, that's okay, because babies are constantly sucking on that, right? So, but if it is too much, then definitely you need to get it checked. I don't think it's right for me to just advise on that if it is very hard for 2 days.
Can a mother who breastfeeds take vitamins, multivitamin tablets? Will it have any effect on the mother's milk?
No, you can take, because sometimes in breast milk certain things might not be sufficient, and whatever diet you take also matters. If you're not having a balanced diet, then your nutritional value of your milk will also vary. So I think I would strongly recommend you take vitamins during feeding.
Hello, doctor. I had delivered my baby boy on 11th April 2019. I started my first period post that on 18th May, that is 39 days after I delivered. I breastfeed my baby exclusively, but is this normal?
As I said, it's normal for some mothers to get periods within few days of after delivery. But if it is any concern, I would advise you to see the obstetrician.
We had one question earlier on moms getting back to work.
Yeah.
Is there any special tip or special health fact that you would like to share with working mothers who are getting back to work and still breastfeeding?
That's a very positive thing. You're not just giving up your feeding because you've started work, but now there are lots of facilities available in corporate setup or in any office, because now there's a lot of awareness about how to support breastfeeding mothers, how to encourage expressing breast milk during the working hours. So if you're working in the right place and you have the facilities, then please go and express the milk so that you don't get engorged breast and struggle with the pain. And then you can store it and then you can use it, or if someone can collect it from your office, so we can use that. And as I said, it's a very positive thing. You're fed for 6 months and now you're going back to work. It's very, very depressing as a mother, because you're going to leave your child for the first time. But life is all about, like, you have to get used to that, and baby also needs to, otherwise they'll just see your face and that be clingy only to you. So they need to get to know the other members of the family also. So as I said, it's always a nice thing. You fed for so many months and then now you're going for work, and it's always very positive to do that.
Hello, doctor. I was feeding for 4 months using lactate tablet. I discontinued it for a month, and the supply came down, and the baby also stopped feeding. Can I continue this tablet? And is it possible that the baby will start feeding again? Also, would like to know, is it true that people keep saying that we get thyroid using these tablets?
I'm not very sure about thyroid as such, because I've not heard about it, but I can always double check and let you know. Regarding lactic capsules, we do use it in mothers where their milk production is not established for some reason. and you've used it, you've stopped, and then now you're asking whether you want to reuse it to improve your milk production. I think you should be able to do that. There is no contraindication in that. Sometimes it does, even after stopping and restarting, it does help some mothers. So I would always suggest you should go for it and try.
Are there any trained breastfeeding experts in Chennai who can help us understand and breastfeed our children better?
Yes, definitely. We have people called, a trained person called a lactation consultant. Every hospital has lactation consultants who will guide you. They've done their study only on lactation. How to help babies and mothers during. So they do see mothers even before you deliver your baby. Antenatally itself, they will see the mother. If you have any doubts, you can go through with them, and they are very, very useful, because some mothers have a lot of anxiety even before they've started breastfeeding. So that helps mothers to understand breastfeeding better. And also during if you see the lactation consultant person, sometimes they will be available at the time of delivery, just to encourage the breastfeeding as soon as the baby is born. So they advise all this breast crawl as soon as baby is born. What babies do is wonderful, and each mother knows exactly who has gone through that. So lactation consultants are very useful during this time. So there are lots of them available. So if any help is needed, we are happy to help.
When should I stop breastfeeding?
Again, there is a lot of recommendation about when to stop. WHO says around 2 years. But sometimes practically it is difficult to do. Like for working mothers, sometimes they can become too clingy, not eating. These are the complaints we normally get from mothers because they are on breast milk. My advice, try to do it around 18 months, whichever mutually works for mother and baby. If she's happy to feed for 2 years, that's absolutely fun. But that's what our recommendation, 18 to 24 months.
What is your advice to our viewers today, doctor?
We are celebrating breastfeeding week, and be positive about breastfeeding. And as I said, there is a lot of information about breastfeeding, the benefits of breastfeeding both to the mother and baby. Just make yourself informative about these things, because when it comes to your own baby, you're doing the best for your baby. So when a lot of extended family members, or there's sometimes mixed opinion, or you get really confused, so don't give up. Just keep feeding your baby. Everything will be okay.
Thank you very much for a wonderful, informative session, doctor. For more information and appointments with Dr. Latha Kanchi Parthasarathy, please connect at 044 2829 8154. I repeat, 044 2829 8154. Thank you very much, doctor. Thank you, viewers.
Thank you. Happy breastfeeding week. Thank you.